Hi, my name is Corey Johnson. I work on the social media team here at Children's Hospital of Wisconsin. Thank you so much for joining us. We have a really special broadcast lined up for you today. We're here at our Delafield Clinic, and we're going to broadcast live as our fracture care team puts a cast on 17-year-old Morgan, who broke her wrist while playing soccer about a month ago. But before we do that, I want to introduce you to Dr. Channing Tassone. He's one of our orthopedic surgeons here at Children's Hospital of Wisconsin. And so, Dr. Tassone, before we go into the other room to watch us put a cast on Morgan, I was wondering if you could talk a little bit about the experience that patients receive here at our Delafield Clinic when they come in for fracture care.
Sure, thank you. So coming out to Delafield is really a fulfillment of one of children's biggest missions. We want to be able to provide care for all of the patients in southeastern Wisconsin and the whole state as close to home as possible. So a little over a year ago, we opened the Delafield Clinic because we know that a need for this western side of the city was not being met by our campuses back at main campus and at the Greenfield Clinic. So we've been out here for a year. We love the facility. We think it's great for all the people in the community, and we provide all of the pediatric orthopedic care from primary care, sports medicine, through sports, surgical care, and then fractures and the rest of orthopedics. For the fracture care, it's great because it's both a convenient location like I talked about, but also the ease of access. There's nice surface parking. People can walk right in, get their care from our team. They get their casts here. They get all the care they need, and then right back home as quickly and easily as possible.
And so Morgan is going from a long arm cast to a short arm cast today. Can you explain what does that mean?
Yeah, so when young people break their bones, there are oftentimes the bone actually shifts when it breaks, and so then it needs to be held very rigidly. And so for the early part of healing, oftentimes we'll do a more extensive cast because it holds the bone in place. So for Morgan, she had to be in a long arm cast for the first month because of the nature of the injury. And then what we try to do, we know how important it is for these kids to get moving and get back to life as quickly as possible. So as soon as we start to see some early healing, then we'll transition them into a short arm cast so that they can start to move their elbow again, start to care for themselves more easily, write, and do other things they want to do.
And so Morgan is in the room right here, and she's already come in and the long arm cast has been removed, is that right?
Yep.
And she had an x-ray,
yep.
Is that right? Okay, and so we're going to introduce you to Morgan in just a minute, but first I want to introduce you to Amanda and Sandra. These are two of our orthopedic technicians that are going to be working with Morgan today. So let's take it away. So Dr. Tassone, what are we doing right now? What is this cart?
This is our cast cart, and this goes to each of the rooms that we care for the patients. So all the clinic surrounding has all the different rooms. Wherever Amanda and Sandra need to put on a cast, we'll actually bring this cart in. It has all the supplies they need, from the cast material to the glitter, which a lot of our patients love on their casts, and then they can move. So the patient can stay in their room for their convenience, and we move to them to get the care they need.
All right, let's go in.
How are you guys? Thank you for participating in this little event. How have you been?
I've been good.
Yeah? Everything going okay? No problems?
Nope.
Good.
So this is 17-year-old Morgan and Mom, Kim, in the back. And so as I understand it, Morgan broke her wrist while playing soccer about a month ago. Is that right? Okay.
And then what'd you do right after you got your cast on? I'm sure everyone wants to hear that.
I went to prom the day after.
And then the day after that also was a big day too, right?
I had confirmation.
So we sort of ran the gamut of things we could do with a long arm cast on. How did it all go okay?
Yes, it was fine.
Great, great, great. And so the good news is, so far, everything's been going great with the healing. The x-rays look absolutely perfect. Everything has stayed right where it was supposed to. And so today is probably a good day for you because you get to switch to a short cast and also a waterproof cast. And so that is one of the things that we also know is so important to young people, is to be able to bathe normally and things like that. So as soon as we can, and as soon as it's medically appropriate, we transition kids into a waterproof cast. So then literally they can start swimming and showering and going in the lake and doing anything they want to do with that cast on, which in Wisconsin summers, we need to take advantage of the limited good weather we get. So we like people to be in the waterproof casts. Have you already picked your color?
Yes, light blue.
Light blue.
All right. All right, so I'm just going to slide this on your arm.
So, Dr. Tassone, as we're watching this, can you help explain why is it different treating kids for broken bones than adults? Why would somebody need to see a pediatric specialist for something like this?
Yeah, so there's a variety of answers to that question. The obvious one is the whole concept of the growth plate. So kids' bones have growth plates in them, and growth plates both heal differently but also can be injured very differently. And the implications of the growth plate to the rest of the child's function are extremely important. And so whenever there's a growth plate injury, which is a lot of the injuries we take care of, it's really critical that you are being cared for by somebody who deals with growth plate injuries regularly, knows the important things to look for, and knows how to take care of them perfectly. The other interesting thing, and Morgan's a great example of this, Morgan's old enough that her growth plates are closed, but she still had a fairly significant wrist injury. And what's unique about Morgan, that the care she would get from us versus the care potentially from an adult provider who sees a wrist fracture, their first instinct is everything needs surgery. And so they would do a fairly extensive surgery, or could do a fairly extensive surgery on an injury like this. Because we are so comfortable taking care of kids and we know how well they heal, we know that this is going to heal great with just a cast. And so we wouldn't expose her to the risk of surgery. We know in the long term she's going to do perfectly. And so everything about the way they get cared for is just different, and we know we can give them the best care they can get here at Children's.
And this may be a dumb question, but what is a cast like this made out of?
Yeah, it's a great question. So what you're seeing right now, Amanda putting on, is the roll that's unwrapping right now is actually fiberglass, just regular old good old-fashioned fiberglass. And the good news is fiberglass is waterproof, and so that's what makes it able to be a waterproof cast. The difference with the waterproof cast versus our normal cast is actually what you saw Amanda putting on first. That under wrap, so some casts, the underneath padding, so you have to put padding. You can't put fiberglass directly onto the skin. So for casts that aren't waterproof, the padding that goes underneath is cotton. And so the reason a cotton padding cast isn't waterproof is because that cotton would get wet and it would stay wet, and then it would sit on the patient's skin and it could create skin problems. In contrast, the waterproof material that was put on first here, actually the water doesn't absorb into it, it just sheets the water right through. That's what makes this a waterproof cast.
And if we were watching us put a cast on, say, a toddler or a younger child, would the experience be much different, or how do we accommodate younger kids versus maybe teenagers?
Because we take care of so many younger kids, we do anything we can to make them comfortable. We involve the parents potentially more if that's helpful. In the very young, we even go as far as using pacifiers and things like that. So we pretty much do what we do whatever it takes in an age-appropriate way to make sure the experience for the patient is as peaceful and non-traumatic as possible. The casting itself, same process.
Okay. And so, Mom,
yes.
Kim, nice to see you. Do you want to just describe for maybe a minute what happened when Morgan broke her wrist?
Morgan plays soccer for her high school, and she unfortunately was way out in Whitewater at a game and took a fall, and so they had to take her to the ER. So they drove back to actually the Children's Clinic in New Berlin, which was a great experience. Took care of her there, and then it was great. They could send the x-rays right over to Children's Hospital, and then they sent us over to the hospital, and I think we got there about midnight. They were great. Morgan did have to, I think, have a bone pushed by the place, so she did great. Got out of there at 1 with the cast, and it was great communication, easy follow-up care with Children's Hospital, setting us up with our appointments. I mean, it's been stress-free. So yeah, they've been great. It's been a great experience.
And how was the last 4 weeks then with Morgan's cast? Has she been able to get used to it?
Yeah, it was pretty heavy. But no, she got used to it, and no, she's excited to have the shorter cast. She could possibly make her last 2 soccer games.
Oh, great. So, Morgan, why did you pick blue for your color of your cast?
Well, it's a lighter color, and I didn't want like hot pink or something. It goes with outfits.
Yeah, great.
All right, so we just put a little sleeve over the top until it fully dries because it can stain your clothes. So after about 15 minutes, you can just pull this right off, okay?
And then you also are going to receive one of our shirts today for coming to see us. We did it for the cool cast. If you'd like, you can post a picture of yourself with your cast on any of our social media sites.
So, Dr. Tassone, for our patients who come in for fracture care and when they receive the cast, we give them T-shirts sometimes. Is that right?
You bet.
And how have the patients like that? Have they been enjoying the shirts?
They do. It's going through the whole broken bone experience is traumatic enough, and so it's a little something we can do to try to make it a little more positive. And then, yeah, you can see all the pictures on all the different social media sites. I think they enjoy posting the pictures almost as much as getting the T-shirts.
And then if a family was interested in requesting an appointment for fracture care at Children's Hospital Wisconsin, what are the locations that they can receive fracture care?
Absolutely. So main campus, obviously, in Wauwatosa, and then we have our Greenfield Clinic, which is at Oklahoma and 45, our clinic that we're at right now out in Delafield, and then August 1, Amanda, August 1?
Yeah.
August 1, we'll be opening our new Mequon Clinic. So really fulfilling that care closer to home throughout the community.
Great. And if anybody has any additional questions about the fracture care that we provide at Children's Hospital of Wisconsin, feel free to visit our website. You can go to chw.org/fracture, and you can call our central scheduling line to request an appointment at 414-607-5280. And I want to say thank you to Dr. Tassone, to Kim, and of course to Morgan. You guys have been awesome. I really am just so grateful you participated in today's live broadcast. So thank you everybody for joining us.
Thank you, guys.
Thank you.